JoyNews' checks have revealed a third casualty from the coronavirus pandemic. The deceased is said to be an elderly person whose husband is believed to have also tested positive for the virus. The news comes as Ghana's case count jumps from 53 to 68 in less than 24 hours, as 15 more people are confirmed to be carrying the disease. Here's the head of our health desk, Fred Smith, with more.
Well, this is a breaking news for us. This hour, we do understand that Ghana has now recorded the third death out of the coronavirus infections. We do understand that this person who has passed on is a woman above 50 years of age, and her husband as well, we do know that is also infected, has tested positive, and currently at the hospital as we speak. No official confirmation yet, but JoyNews sources within the facility have confirmed that this happened on Friday. The patient called and assistance went to her, but the person came here and went through OPD to be admitted on the coronavirus infection. I think the facility itself is prepared for the coronavirus infection, and anybody coming into the facility is checked for temperature before they can enter. That's a very good sign for this particular hospital. I've had to be strapped this way to be sure that I'm fully protected, because we do know that the case came in through OPD before officials were able to detect that they were positive for COVID-19. Well, as we speak, we are waiting for official confirmation of this figure. But in the last hour, government has updated the case count to 68, but it does not include this death that our sources tell us. We are hoping that very soon government will come out with that information and announce to the general public. For JoyNews, I'm Fred Smith.
Fred Smith there, and he joins us now, looking a little less like Darth Vader. But it looks like that was a rather serious situation there. You had to give yourself as much protection as possible, right?
Yes, indeed, because the source told us there was a need for us to protect ourselves that much, so we did it. Yeah.
So let's break this down a little bit. We know that this suspected casualty is a woman, right?
Yes.
The wife of a high-ranking military officer.
Yes.
What else do we know?
Well, we know they received a parcel from someone who had just returned from the UK, and so this parcel was from the UK. This person delivered it to them at home. So I'm sure what will happen from now is the contact tracing. This person must be found. Most likely the person is positive, but may not know. And so they find this person, whoever he's been in contact with, they must find that person as well as part of the contact tracing, so that we're able to bring the situation under control. Otherwise, what we're going to have on our hand is community spread, something we don't like.
Do we have timelines here? Do we understand when this package was delivered, how long it took for symptoms to develop and so forth?
We don't know when it was delivered, but we understand the woman fell sick on Friday and started asking for help. And so that help came in. We understand the husband has also developed symptoms and was tested positive and currently receiving treatment. Our understanding is that the husband is doing very well.
Right. So at the moment, with the death toll believed to be at 3, what do the deceased have in common in terms of their biodata? Were they all elderly? Did they all have pre-existing conditions? Do we know anything about what they may have had in common?
Well, it's the age. They are all old, and for each of them, there were underlying conditions. So we will say, but of course, we're still waiting for official confirmation of all of these things.